A doctor just told you your leg needs to come off. A silence in your chest feels louder than anything they said. You're sitting in a room. Maybe it's a toe, maybe it's a foot, maybe more. You're not processing it yet. You're just nodding. Here's what almost everyone does next. They trust it, because what else are they supposed to do when a doctor, maybe 2 or 3 doctors, tells you something is serious? I've taken call from patients across this country in exactly that moment. Some call me the night before a scheduled amputation. Some have already been through multiple specialists. Over and over, I found the same thing. The recommendation came before the full picture was in, before the right questions were asked, before the right tests were done. In a majority of those cases, there was a path to save that limb that no one mentioned. That's what this video is, a personal playbook. If I were sitting where you are sitting right now, this is exactly what I do. First, second, third, walk with me through this. The one thing you should never do in the first 48 hours. When doctors give you a serious recommendation, you act on it quickly. Delay feels irresponsible, like you're being difficult or in denial, or you're just risking your life by not moving fast. That belief exists because urgency is real in medicine. Doctors sometimes present amputation like the clock is running out. The urgency isn't always wrong, but it's also not always right. And framing can make a patient feel like any pause is dangerous. Here's the problem. Amputation is permanent. What's removed doesn't grow back. Most of the cases I see weren't emergent. They were recommendations made on incomplete information, and the patient felt pressured to move faster than the situation actually required. I had a patient come to me, Bill, 58 years old, after 7 other doctors recommended to amputate. He thought he'd run out of options. He hadn't. To save the leg using 2 targeted local techniques, that was 7 years ago. He still walks on both legs today. If he moved quickly after first recommendation, or the second, or the third, the outcome wouldn't have been possible. Buying time isn't denial. Buying time is due diligence. The recommendation isn't a sentence, it's one opinion, formed with the information that doctor had in front of them. Your job in the next 24 to 48 hours is to make sure that information is complete before you agree to anything that can't be undone. Tell the doctor you need a few days before scheduling. That's a reasonable request. Any physician who respects the gravity of what they're recommending will understand that. Don't cancel. Don't refuse. Just don't sign anything until you've done the next 4 things on my list. The first thing you need to do is find out whether a critical test was ever ordered. Most patients had no idea this test even exists. The test over half amputation patients never get. If a doctor told you there's no blood flow in the limb, you assume that was confirmed with the right test. You assume the workup was complete. Patient trust that diagnostic process is thorough. Most of the times it is. But in the case of amputation decision, there's a specific gap that shows up far more often than it should. Over half the amputations performed in this country are done without adequate vascular tests being performed first. Over 50%. A patient is told they have no blood flow and that the amputation is the only path forward, when in reality, multiple advanced techniques exist to restore blood flow. Techniques that were never attempted because the question was never fully investigated. The vascular supply to your limb isn't binary. It's not flow or no flow. There are graduations, collateral pathways, interventional options that can open supplies where it appears to be absent. But none of these options get offered if nobody runs the right test in the first place. This is the single most important question you can ask before agreeing to anything. Walk into your next appointment and say these exact words. Have you tested my vascular supply? And are there options to restoring my blood flow before proceeding? If the answer is no, or the answer is vague, that's your sign. A second opinion isn't optional, it's necessary. You can't make an informed decision about a permanent procedure based on incomplete diagnostic information. I've seen patients referred to me after amputation recommendations with no vascular imaging in their chart. None. The recommendation was made on a clinical presentation alone. In several of those cases, once vascular testing was completed, a restoration pathway was available. The limb was saved, and it started with one question no one had thought to ask. Asking the right question is step number 2. Step 3 is making sure you're talking to the right person. If you're finding this useful, hit the subscribe. I put out videos like this regularly. Practical and specific guides for people navigating exactly these kind of decisions. Hit subscribe so you don't miss the next one. Why a second opinion might not be enough, and who you actually need to see. Most people think a second opinion goes back to the same type of doctor. They see another orthopedic surgeon, or another general podiatrist, or another hospitalist. And sometimes that second opinion confirms the first one, and they feel like they've done their due diligence. But here's what I've seen again and again. The training background of the specialist matters enormously. A general podiatrist and a limb salvage specialist both went to podiatry school. They may both have the same basic credentials. What they don't share is the specific training and techniques that makes limb preservation possible. When you're looking for a second opinion, there are questions worth asking before you even book the appointment. Does this physician specialize specifically in limb salvage surgery? Do they have experience with reconstructive techniques below the knee? Have they performed procedures involving muscle flaps, skin flaps, or advanced wound care to preserve limbs? Are they board certified in wound care as well as podiatric surgery? You're not looking for a second general opinion. You're looking for someone who's made it their specific focus to find every path possible to keep the limb intact before recommending otherwise. That's a different kind of specialist than the one who may have given you the first recommendation. And when you find that specialist, what you need to understand is the list of options available is longer than most patients realize, which brings me to step 4. The treatment options your doctors may have not mentioned. Most patients walk into an amputation conversation believing it's binary, amputation or risk something worse. That framing isn't accurate, and it's not the framing a limb salvage specialist operates from. The range of tools available to a specialist trained in limb preservation includes advanced techniques to restore blood flow, infection treatment protocols that can clear bone infections without removing the bone, muscle flaps and skin flaps to reconstruct tissue that appears unsalvageable, and advanced skin substitutes that can close wounds that otherwise wouldn't heal. No part of the foot, toe, or leg is considered too small, too damaged to attempt to save before a recommendation is made. I had a patient, Alice, 43. She came to me with a Charcot foot. She had been told to give up on her foot or accept amputation. There was no middle option offered to her. I performed stage surgery. She returned to regular shoes. This process wasn't fast or simple, but the option existed. Nobody had presented it to her until she found a specialist who worked with the full range of what was available. Stop accepting framing that there are only 2 variables, speed and risk. The real variable is whether the person advising you has access to the training and the full menu of what's possible. Start asking, what's the least invasive path that still gives us a chance to save this? What would you need to be true for that path to work? What hasn't been tried yet? These questions shift the conversation from a yes or no about amputation to a genuine clinical exploration. And there's one more question, one that almost nobody asks, because almost nobody knows to ask it. It's a question about what the amputation does to the rest of your body, not just the limb. What your doctor isn't telling you about what happens to your heart after amputation. This is the question that changes the entire weight of the decision. And it's the one I almost never see patients walking in having already asked. Your heart is built to pump blood to the tip of your toes. That's the design. The full length of the vascular circuit, from the heart out to the extremities and back, is what the cardiovascular system is calibrated to do. When you remove the destination, the system doesn't simply adjust and continue as normal. For diabetic patients, amputations can carry an 80% mortality rate within 5 years. That's not a statistic about surgery itself. That's a statistic about what happens to the body after surgery over the following years. The amputation starts a cardiovascular clock that most patients are never told about. By doctors who genuinely have not made that connection part of their informed consent conversation. It isn't about scaring someone away from a procedure that isn't necessary. Sometimes amputation is the right answer, but it should never be the first answer. And the patient should always be told about the full picture of what they're agreeing to, including what it means for their heart, their circulation, and their long-term survival. If you're watching this and you've received an amputation recommendation, here's what I want you to do tonight, tonight. Write down whether any of the following have been done. Vascular imaging, consulting with a limb salvage specialist, a discussion about non-surgical or reconstructive options. If the answer to any of those questions is no, that's your starting point. Search specifically for board-certified limb salvage specialist in your area or within traveling distance. Not a general podiatrist, not an orthopedic surgeon without limb salvage training, a specialist who focuses specifically on preservation. Call that office in the morning and tell them you've received an amputation recommendation and you're seeking a second opinion before proceeding. Most limb salvage specialists will see you quickly. They understand the urgency. That's it. 3 things tonight, because the decision you make in the next few days is permanent. I say this to every patient who calls me. If someone has told you you need an amputation, call me. I don't care what state you're in or what country you're calling from. I'll give you an honest opinion about whether that recommendation is the only path forward. Because the majority of things that get amputated shouldn't be amputated. And every person deserves a real chance to save part of their body before agreeing to lose it. You're your own best advocate in this. Ask the questions. Get the right second opinion. Don't sign anything until you have the full picture. If you haven't seen the video that started this series, go watch it now. It's called Before You Agree to Toe or Foot Amputation, Watch This. The link's right there.